Hi there, I'm Brian Fitzsimmons. I'm an obstetrician gynecologist, medical director of the care program at BC Women's Hospital. Well, there's many different types of birth control available here in 2014 in Canada. We have barrier forms of contraception, medication contraception, as well as IUDs, which are intrauterine devices. Um, the best and most most effective forms of contraception are those that are longer acting reversible. They call them LARCs, LARC, which are long acting reversible contraception. And that would be the IUDs, such as the Mirena or the JDES IUD, which have a type of progesterone in it that prevent pregnancy, decrease uterine bleeding, and may have a decreased risk of infection, as well as the copper IUDs. And the JDES and the Mirena IUDs can stay in for 3 and 5 years respectively. And the copper IUDs actually can be left in for 10 years unless a woman changes her mind and wants it removed if she wants to get pregnant. So I'm a very strong proponent for the long-acting reversible methods of contraception. And they're safe for all women who are interested in having them. There's no stipulation that someone has to have had a child before she has an IUD. And the IUDs used today are quite safe and are used around the world routinely with very, very safe outcomes. Other forms of contraception include birth control pills and a device called NuvaRing. Those are medication contraception, and they contain estrogen and progesterone. The NuvaRing is a vaginal ring that a woman puts in her vagina, and she takes it out after 3 weeks for a week and then puts another one in, or she can leave it in for 4 weeks and then change it. The advantage of the NuvaRing versus the pill is that she doesn't have to remember taking a pill every day. It's a little ring device that stays in the vagina. It's very comfortable for most women and causes very few side effects. And the bonus is that there's very low dose of hormones, and the woman doesn't get as many of the side effects as some of the oral contraceptives. The oral contraceptives, which have been around for many, many years, have gradually come down in dosage with respect to the estrogen, and the progesterones have fewer side effects compared to the pills that were available, say, 20 or 30 years ago. And the benefit of that is there's less breakthrough bleeding, less headaches, and less other side effects. And that improves compliance. So women are more likely to keep taking them if they've chosen that way for their contraception. And then, of course, there's barrier methods. We can talk about the diaphragm, condoms, um, cervical caps. Cervical caps and diaphragms aren't used as much these days. Condoms are very common, and condoms are actually very good as well at reducing risk of STI and transmission of HIV and hepatitis, as well as syphilis and gonorrhea.